talk about something gross. Hi, my name is Ruby. I'm 10 years old in the 4th grade at Big Lake Elementary. This is my second year in 4-H, and I show my horse, Kid, in the BE Roadrunners 4-H Club. Today I will be showing you common worms in horses and how to treat them. First, I'd like to start off with strong guiles. Strong guiles can get up to 10 to 12 inches, and it can cause diseases. Larvae can turn into adult worms or stay larvae for up to 3 months. What type of medicine to use for strong guiles? Some good examples are ivermectin or moxidectin. Horses get strong guiles by grazing and eating them in the field or in the pasture. Next, I'd like to talk about the life cycle of strong guiles. Life cycle of the large strong guiles. Stage 1. Eggs are in feces in pasture. Stage 2. Eggs develop into larvae. Stage 3. Larvae attach and live on the grass. The horse then eats the grass, ingesting the larva. The larva then penetrates the intestinal wall. Stage 4. The larvae develop into adults and lay eggs. The eggs then pass out of the horse in feces, starting the cycle again. Small strong guiles have a very similar life cycle, except the larvae do not migrate beyond the wall of intestines. They burrow into the wall of the large colon. Next, I'd like to talk about one of my favorites, the tapeworm. Tapeworms can get up to 80 feet long, which is the same as 25 meters. Symptoms may include diminished performance, pain and discomfort, increased flatulence, pawing, trying to lay down, malaise, nipping at sides, or refusing to eat. The tapeworm can cause severe damage inside the horse's intestinal tract. Its presence can lead to decreased intestinal motility and colic. Which medicine to use for tapeworms? Ivermectin or moxidectin are a good example of some medicines to use for tapeworms. Horses get tapeworms by eating small pasture mites during grazing. Next, I'd like to talk about the life cycle of tapeworms. Tapeworms develop into adults within the gut. That is stage 1. Stage 2 is proglottids are produced, which mature and eventually become gravid. Stage 3. Gravid proglottids are passed in the feces, where they rupture and release the tapeworm's eggs into the pasture. Stage 4. Eggs are ingested by the intermediate host free living on orbited mites, which live in the soil, where they develop into cystis coots. Stage 5. Infected mites are inadvertently consumed by horses during grazing, and the tapeworm larvae are released. Next worm I'd like to talk about is the threadworm. Threadworms can grow up to 13 millimeters long. Symptoms may include them being very itchy on the neck and hair loss on the neck. The threadworms usually cause little harm to an adult horse. Infected foals have signs of colic, diarrhea, and overall failure to thrive. Which medicine to use for threadworms? Ivermectin or moxidectin are a good example of medicines to use for threadworms. Horses get threadworms by eating eggs in the pasture while grazing. Next, I like to talk about pinworms. Pinworms are very small. They can get up to 1.5 inches. Symptoms may include weight loss. Fortunately, about the only damage that pinworms cause is itching of the tail head and hair loss in that area. Pinworms cannot cause a disease, thankfully. Which type of medicine to use for pinworms? Pyrental is a great example of medicine to use for pinworms. Horses get pinworms by eating the eggs in the pasture or hay that is left out. Next, I'd like to talk about the pinworm's life cycle. Stage 1. Eggs passed in feces. Stage 2. Infective eggs and or larvae develop. Stage 3. Infective stages ingested in feed and water. Stage 4. Immature worms migrate in tissues. Stage 5. Mature worms live in intestinal tract. Next, I'd like to talk about roundworms. Roundworms can get up to 3 to 6 inches long. Symptoms include unthriftiness, potbelly, rough hair coat, and slow growth. The roundworms can get a disease such as cough or nasal discharge. Which medicine to use for roundworms? Ivermectin, Panicur, or Pyrental are some great examples of medicine for roundworms. Horses get roundworms by eating eggs in the pasture. Next, I'd like to talk about the life cycle of roundworms. Stage 1. Adult females may lay up to 200,000 eggs in the small intestine. Eggs are passed in the manure and an embryo develops that may live for 10 years without hatching. Stage 3. Mature eggs are eaten and hatch when swallowed. The larva goes through the intestinal wall into the liver. Stage 4. The blood from the liver carries the larva to the lungs. The larva gets into the airway. Stage 5, the last stage. Larvae are coughed up, swallowed, and become adult in the small intestines. Next, I'd like to talk about botworms. Botflies can carry serious disease and larvae can cause infection. What type of medicine to use for botworms? Ivermectin and moxidectin are some great examples of medicine for botworms. Horses get botworms by flies laying eggs on the horse, specifically in the neck area and legs. Next I would like to talk about the life cycle of botworms. Stage 1. Adult botflies pester horses in July to frost. Stage 2. Botflies lay eggs on horses in the areas of throat and legs. Stage 3. The eggs hatch and somehow end up in their stomach. Then they travel out of the stomach into their poop and fly out as a fly. Next, I'd like to talk about this. These are just some examples of what flies and where, or what worms and where they are in the horse, or where they can get them. This is the rotation deworming schedule. So January, February, pyrantel is a good one to use. March and April, benzimidazole. In May, June, ivermectin, and then so on and so on. Just repeat the process. Next, I'd like to talk about all of this. Medicines to use for horses. First is the injection. You would use a syringe to put in this medication to put it in your horse to help them with the worms. This is just a picture of the paste, and the paste and gel are very similar, and it just has a little knob to go to their weight to put it in their mouth. Same with the gel. They are very similar. And this is a single dose of pellets. You want to feed them daily or monthly of this. Hand feed or grain. And this is a picture of pasture maintenance. So you want to keep your pasture clean and no poop in them, so not much worms or flies can get in them and pester your horses and get in your horse's stomach. So just always keep your fields clean. This will conclude my presentation. I talked about many different worms and how they affect horses, their life cycles, and when and how to treat them. The information that I found was in many different articles from university, scholarly, and multiple veterinarian websites and live chats. Are there any questions? If there are no further questions, this may conclude my presentation.